it's my pleasure to introduce Professor Yu. Professor Yu is currently the chief of the Uro-Oncology Department in Linkou Chang'an Memorial Hospital. And he has been actively involved in robotic surgery and also urogenital cancer research. And he just obtained his PhD degree from National Technology University, Taipei. And he has spent 2 years of fellowship in MD Anderson in America. So it is recently he had picked up this protocol in my hospital. And it's a time that we like to hear from his experience and also probably the whole team in Linkou Chang'an's experience. So let's welcome Dr. Yu for his excellent talk. Thank you.
Thank you for your introduction. Moderator, Professor Feng, Professor Zhang, our distinguished guest, Professor Shouji, and all the urology experts, Happy Lunar New Year. I'm Dr. Yu. It's my pleasure and privilege to share our preliminary treatment experience with the novel HIFU system, Sonablade, for localized prostate cancer. And this is the outline today. And I would like to focus on the problem why HIFU has more and more important role in the prostate cancer treatment, and also the comparison to robotic surgery as well. And then, by quick review of our preliminary data, we could further strengthen the advantages of HIFU by some modifications, and hope in the future we could join the cases together with Professor Shoji to find the most appropriate standard for Asian cancers. And we know that the incidence of prostate cancer is increasing, which made prostate cancer the most frequently diagnosed cancer in male patients. And according to our current procedures, we found that earlier diagnosis of lower clinical stages, lower grades, and small volume of cancer was found. And surprisingly, about 20% of cases with radical surgery have unilateral tumors, which can be treated probably by the focal therapy to reduce the associated problem caused by radical treatment. And HIFU was proved to be one of the best approaches because it can be performed with real-time control, and multiple ablation could be safely applied without the fear of radiation dose or the adhesion. And the French group, they published their early studies from 2009 to 2013. They include unilateral cancers with the clinical stage T1C to T2A, and the maximal positive scores less than 1/3, with the Gleason score 7 and the PSA less than 15, and the patient's life expectancy more than 10 years. And they exclude patients with previous prostate cancer treatment. And most patients complete the follow-up collection, and the mean age was around 70 years old. And the mean number of core biopsies were 22, and the baseline Gleason score was 3+3 and 3+4 for most of patients. And the median PSA before HIFU was around 6, and the median mean prostate volume was around 40 grams. And we found that around 60% of patients underwent their HIFU hemiablation on the right side, and the maximal diameter of the tumor was around 6 millimeters. And after 12 months follow-up, they found that most patients had negative biopsy in the treated lobe, and only 11 patients have positive biopsy in the treated lobe. And the median PSA drop rate was around 43% at 3 months, and the PSA nadir was 2.6, and the biochemical recurrence in only 10% of the patients. And all patients, they found that were continent after the HIFU treatment. And after the 3 months of the HIFU, they found the IPSS, the ICS score doesn't have much change. And all complications were encountered during the first month, and which is around 15%. And most patients have grade 2 complications, and only around 3% have grade 3B complications, mostly because the urine retention resolved by TURP. And another recent study, it's a multi-institutional studies performed by French Association of Urology. They had similar inclusion criteria, but they have more strict regulation at the biopsy. They exclude tumors closer to apex and the midline. And they include more TURP procedures during the HIFU treatment for patients with volume more than 50 grams or they have previous obstructions. And TURP was done either 2 months before HIFU or in the combination HIFU procedure. And they include around 100 patients, and most of the patients were low-risk group. And after the follow-up biopsy, they found that 95% and 93% had no clinical significant cancer in the treated or the contralateral lobes. And the median PSA at 2 years was 2.3. And the radical treatment-free survival at 2 years around 90%. And at 1 year, the continence and erectile function were almost preserved at 97% and almost 80%. And no significant quality of life decrease was noted. And the grade 3 AE was around 10%. And the grade 3 AE was mainly coming from the urinary retention, the urethral stricture or gross hematuria. Those symptoms can be resolved easily by TURP. And about the rationale of additional treatment, when a patient have biochemical failure, they have 3 options for these patients, either the second HIFU or the radical surgery or the radiation. And after the failure of the double HIFU procedures, the radical surgery or radiation therapy was indicated. And around the most famous institution, they have more and more patients underwent HIFU. Another prospective study for a HIFU coming from 2016 and 2018 was collected. They include more and more high-grade patients. And also, they have found that more patients need the transurethral, the TURP or laser enucleation. And they found that they have more than 2/3 of patients have more than grade 2 cancers. And after the follow-up, they found that 83% had negative in-field biopsy results, and only about 13% had de novo positive out-of-field biopsy result. And the PSA decline trend over 12 months was found both in patients with or without TURP. And then the decreasing trend was very significant for all the patients. And they found that only 10% of patients underwent grade 3 AE, and the urinary symptoms returned to baseline within 3 to 6 months, and the sexual function returned to baseline in about 12 months. And how about the results with radical robotic prostatectomy? Because there is a study with a matched pair analysis published in 2017 from Miami. They found that they have 55% underwent hemiablation of the HIFU. They have only unilateral and localized prostate cancer from 2007 and 2015. And another cohort with 1-to-1 match, they underwent radical prostatectomy with robotic surgery. And the median follow-up was 3 years. And they found that HIFU has a better and faster recovery of the continence. And most of the patients, around more than 80%, even have no signs of incontinence right after the surgery. And they found also that erectile dysfunction was significantly lower at the HIFU group patients. And there is no difference for the oncologic outcome because the need for salvage radiation therapy or the ADT was not so different. And there is no patient died of prostate cancer after follow-up. So they found that for localized unilateral prostate cancer, Hemi ablation HIFU has comparable oncologic outcome, but with better functional outcome. So it seems that it's so safe with good oncological outcomes and better recovery from the HIFU. And how about our data with so much evidence showing the advantages? And we include prostate cancers either by trust biopsy or the MRI fusion biopsy. And then Hemi, or the whole gland ablation, was decided by the surgeon's preference. And we include initially without any limitation of the cancer grading. And we found that 43 HIFU patients were included, but only 39 patients complete all the data collection. And the mean age was not much difference, and the mean PSA was around 13. The Gleason score were belong to grading 1, grading 2, grading 3 in most of the patients. And the clinical stage was T2 in around 90% and T3 in only a few patients. And the Hemi ablation was done about half, and another half whole gland ablation. And we found that more patients in our cohort underwent TURP or green light vaporization during the combination HIFU procedures, because I will show you the case thereafter. And the median post-operative hospital stay is around 2 days. And at 3 months, all patients were continent, and the potency retained to the normal status in 3 months, around almost 100%. And post-op 1 month PSA reduction rate was about 80%, and continuous decline was found. And the complication rate was around 15%, with most grade 2 complication and only a few grade 3 complications. And this is what the very first case we found we do. We think that the patient is the best candidate for HIFU Hemi ablation without any other TURP. This is a 70-year-old with only minor disease, and he complained severe LUTs for many years under medication. And when the PSA elevated in 2021 June, about 6, the LMD trust biopsy was done, but the results was negative. And then the PSA progressed elevated to around 9 in last year, April, and we do some MRI study for the patient, and MRI showed 1 pyrite 4 lesion in the right peripheral zone. And so the MRI fusion biopsy was arranged for this small lesion at the very peripheral area. So the MRI lesion, we can show very clear the images in the real time. So we do the biopsy very smoothly. And the biopsy result show that the targeted biopsy has Gleason score 3+4 tumor cancer lesions. And other randomized biopsy was all negative. So after discussion with the patients, they decided a right Hemi ablation with the HIFU. And we don't think that TURP is indicated because he has a very small prostate. But after this one day after the HIFU, the patient was discharged, and then he came back to the ER with very severe UTI and Foley tube obstruction. And then after the complete antibiotic treatment, the Foley was removed 2 weeks after the HIFU. But the patients still have the dysuria and the voiding dysfunction. And then after another 2 weeks antibiotic treatment, the symptoms resolved. However, the recurrent episode found around 2 months after the HIFU, and the patient has urine retention and admission for treatment. And UCA showed very significant bacterial infections, but sensitive to ciprofloxacin. And then after the UTI episode was treated, the Foley tube was removed, and the patient had no any voiding problem thereafter. And the PSA value from the before treatment was around 8, and then after 2 weeks of the HIFU treatment, the PSA reduced to around 3, and then decline continued. And the patient complained about the urinary dysfunction for about almost 2 months. And after this experience, we consider that maybe TURP is a very important issue, even for patients with small prostate volume. So this is case 2. The 51-year-old has no any underlying disease. He has fluctuation of PSA from 5 to 7 by health examinations. However, he doesn't have any LUTs, only a minor nocturia. And the TRUST showed not a very big prostate volume, and the TRUST biopsy at other hospitals showed negative of malignancy from 2021. And then the PSA still elevated during the follow-up. And then I have an MI for this patient, and the images showed one pyrite 5 lesion at the left peripheral zone. And the lesion was very big enough for regular TRUST biopsy. The maximal diameter was about 1.6 centimeters. So I arranged the TRUST biopsy for the patient, and the Gleason score 4.3 lesion was found, and the bone scan was negative. Because the patient is very young and doesn't have any LUTs, so he decided to have hemiablation of the left side tumors. But we have that experience, so we communicate with the patients. The patient is still decided for combination TURP surgery during the HIFU. So we can find that this left side tumor is very peripheral and very prominent. So we just do the left side hemiablation for the patient completely without any neurovascular preservation. And this is the TURP after the HIFU. We can find that, next one, a lot of soft tissues in the prostate urethra, next. And then the bladder neck is preserved, next. And after the TURP, we use the green light for the bladder outlet obstruction, and it showed a very clear outlet. And then after the HIFU and the green light vaporization, the PSA dropped significantly, even 2 months after the HIFU. And the patient didn't have any urinary dysfunction, either. Also, the erectile was preserved very well. So based on our short-term preliminary analysis, we found that for unilateral organ-confined prostate cancer, HIFU hemiablation might as a very good alternative way to radical treatment, because the HIFU can have a comparable oncology outcome as well. They can have good urinary function and erectile function preservation. However, for small prostate volume patients, even after the HIFU treatment, we should consider the bladder outlet obstruction for this patient. We may consider the bladder function before the HIFU and also the previous urinary flow study to judge whether the patient should have TURP or laser vaporization during the HIFU treatment. And this is my report. Thank you very much.
Thank you very much, Dr. Yu, for your excellent talk. I think we still have some time. Maybe we can have a combined discussion together, including our audience, and maybe Dr. Yu and Dr. Shoji can answer your question. So is there any question from the floor regarding both surgeon experience, new data, or comments? Yeah, Professor Zhang.
So if a low intermediate risk focal lesion located in the major part of prostate with big prostate gland, what's your recommendation? Do you use the focal HIFU directly, or you should perform the TURP in the procedure of HIFU?
Thank you very much. Okay. So in your experience, so TURP is needed for the patient, only patient who had prostate cancer and prostate target cancer located in the anterior portion in large prostate or large calcification. Only such a patient. As a patient, there is no need to perform TAP before the treatment, in my experience.
Thank you, Professor Shoji. Your result is so amazing, especially you mentioned that the post-op Foley indwelling is within 24 hours. But in my experience and other colleagues, we found that after the HIFU ablation, we can find the surface of the prostate mucosa is whitened, it's very thick or hard. So maybe for some small volume patients, their voiding is smooth when the prostate is normal. But after the treatment, the consistency of the prostate changed. So it's so hard to decide whether the patient should do the TURP before or during the HIFU. So may I ask for your comment about how to decide according to prostate size or preoperative voiding functions to decide whether which kind of patient should do the combination treatment?
Yes, so in standard protocol, no need TAP. Yeah, because of course after the treatment, within 2 months, the patient felt the discomfortability in the urination. However, maybe gradually the urination would be improved after the treatment. So please try the removal within 24 hours, please.
So you use the compression method during the HIFU
of course.
to resolve this problem?
Yeah.
Okay, thank you.
So, yeah, Professor Zhang.
I think you can remove the Foley within 24 hours because you have done quite a lot of focal therapy. But instead, in Taiwan, because we have the high-risk patient, recent score A910 in nearly half patient in our Taiwanese people. So I seldom use the focal therapy. Instead, I use the whole gram or subtotal. But if you perform whole gram or subtotal, there's quite a lot of sloughing tissue, just the doctor is show, and quite a lot of sloughing tissue. So maybe quite a lot of patients cannot urinate within 24 hours. So that's why we always perform the TURP. Actually, 2 years ago, we performed a TURP before HIFU. But recently, I changed. After the HIFU procedure, I performed the TURP. So almost all patients can urinate. But if they cannot urinate, we will teach the CIC, chronic intermittent catheter. So urinary retention is no more a problem in my hand. So this is my experience. I think the quite difference is that Dr. Show's patient receive a focal therapy. But in Taiwan, we use the subtotal or whole gram. So that's the big difference.
I agree with you. So in my experience, after 4-gram therapy, at least 2 weeks catheterization is needed.
Yeah, sorry, Dr. Zhang.
Some patients experience because of some incrustation over the prostatic fossa. Do you have any predictors or how to prevention the incrustation that may induce some dysuria after HIFU?
I don't know why the calcification was occurred after the focal therapy or HIFU treatment, but maybe it's no problem for the patient after treatment, maybe. Please, I didn't understand what you want to ask.
张教授要不要再补充你的问题？他不太清楚。
Actually, I think that because after HIFU, we will follow patient's voiding function. Some patient experienced severe dysuria. And then we check the cystoscopy. We find some incrustation, like such a like a calcification like over the prostate fossa that cause the dysuria. So my concern is how to prevention the incrustation or any predictors that can predict the patient after HIFU, they will cause some incrustation. Yeah.
Okay, so for such a case, we should perform TAP or as a treatment for the phenomena of the HIFU in the prostate. Good?
I think that's related to the tissue sloughing.
There is.
Time will change the tissue sloughing. Probably the very last question from Professor.
Because time is
Chu.
up, maybe you don't need to answer me now, but I'm still very confusing about your compression method. What is the mechanism, the pathophysiological mechanism, why compress the prostate gland will have a better result after HIFU? Maybe you squeeze the tissue, less blood inside, less edema, have a higher temperature, I don't know. Then my question for you is there any other people have reproduced your method internationally?
Internationally, I don't know, but in Japan, totally this method used.
All Japanese doctors do compression?
All Japanese doctor, but a few medical doctor performing as a HIFU. So.
But compression is very objective. What is the pressure you need to apply for? Okay, maybe we can ask in the future. Yeah. Then maybe you can publish a late paper about this. Okay.
Okay. I think we have newcomer for the next section. So I have to close this section now. Thank you very much for attending this meeting, and thank you our two excellent speakers here today.
Thank you very much.
Thank you.